One of the most dangerous moments of the day for many adults over 60 happens before breakfast, before the news, and before the first cup of coffee. It happens in the first 30 seconds after you wake up. I'm talking about the habit of sitting up and standing too fast. It seems small. It feels normal. But in some older adults, that quick move can trigger a sudden drop in blood pressure, cause a fall, and in serious cases lead to a medical emergency. And here's the part many people miss. The body can give quiet warning signs long before something serious happens. If you have ever stood up and felt the room spin, felt weak in your legs, noticed your vision go dim for a moment, or had to grab the wall to steady yourself, this message matters. After 60, the body often needs a little more time to adjust when you go from lying down to standing. That matters because blood can shift downward into the legs before your heart and blood vessels fully catch up. When that happens, less blood may reach the brain for a few seconds. That can make you feel dizzy, shaky, or suddenly unsteady. Now this is important. Standing up too fast is not just about feeling a little lightheaded. For some people, it can lead to a dangerous fall. And falls after 60 are not small events. A fall can change confidence, mobility, sleep, and independence. Sometimes the real danger is not the dizziness itself. It is what happens next. A trip to the bathroom in low light. A missed step. A hard floor. A hip, a wrist, a head injury. This is why heart doctors and fall prevention experts pay close attention to dizziness when standing and sudden blood pressure drops in older adults. Let's make this simple. Doctors have a name for this. It is called orthostatic hypotension. That sounds technical, but it simply means your blood pressure drops when you stand up. It becomes more common with age. It can also be more likely if you are dehydrated, if you take blood pressure pills, water pills, sleep medicine, or certain nerve or mood medicines, or if you have diabetes, Parkinson's disease, heart problems, or circulation issues. Even getting up quickly, because you need to rush to the bathroom, can make it worse. And I want to stay with you, because in a moment, I'm going to share one small bedside routine that can make mornings much safer. If this sounds familiar, tell me in the comments how old you are, or simply write dizzy, steady, or tired when I stand. I read those comments, and they help me know what videos to make next. And if you want clear, calm health guidance like this for yourself or someone you love, subscribe and stay with me, because the safest part of this whole routine is not what most people expect. So what should you do instead of jumping out of bed? First, when you wake up, do not rush. Give your body a moment. Open your eyes. Take one slow breath in and one slow breath out. Then move your feet and ankles before you sit up. Wiggle your toes. Point your toes away from you, then pull them back. Tighten and relax your calf muscles a few times. These small movements help your circulation get going before you stand. Next, roll to your side and push yourself up slowly. Sit on the edge of the bed for a few seconds. Some people need 5 seconds. Some need 15 or 20. There is no prize for being fast. While you are sitting, notice how you feel. Is your head clear? Are your eyes focused? Do you feel pressure in your chest, fluttering in your heart, or weakness in your legs? If something feels off, pause longer. Then stand up with support nearby, like the bed, a sturdy chair, or a bedside table. That tiny pause can be the difference between feeling steady and losing balance. But there's another reason this morning habit matters. Many older adults blame themselves when they feel dizzy. They think, maybe I'm just getting old. Maybe I'm not strong enough anymore. Please do not brush it off that way. Dizziness when standing is a symptom. It is information. Your body is telling you something. Maybe you need a medication review. Maybe you are not drinking enough fluids. Maybe your blood sugar is running low. Maybe your blood pressure is dropping too much when you stand. And sometimes it can point to a heart rhythm problem or another condition that needs proper attention. Here's the part many people miss. Morning dizziness is often worse after a hot night, after poor sleep, after alcohol, after an illness, or after taking medicines that dry you out. It may also happen more if you wake up and rush because your bladder feels full. This is why the path from bed to bathroom matters so much. Keep it clear. Use a night light. Keep your glasses where you can reach them. Wear slippers or shoes with grip, not loose socks on a smooth floor. If you use a cane or walker, keep it close enough to reach before you stand. Now let's talk about medicine, because this can be confusing and I want to be very careful here. Some medications can make dizziness when standing more likely. Blood pressure medicine, water pills, some medicines for sleep, pain, anxiety, depression, Parkinson's disease, or an enlarged prostate may play a role in some people. That does not mean the medicine is wrong for you, and it definitely does not mean you should stop anything on your own. Please don't make sudden changes without speaking to your doctor or pharmacist. What you can do is ask a smart question at your next visit. You can say, "I feel dizzy when I stand up in the morning. Could any of my medicines be contributing to that?" That one question can lead to a very helpful review. And here is the practical insight I promised to save for later, because it is simple and powerful. Before your feet touch the floor, do what I call the pause, pump, and rise routine. Pause for one full breath. Pump your ankles and tighten your calves 10 times. Then rise in stages, first to sitting, then to standing. It sounds almost too easy. But easy is often what works. This habit does not cure every cause of dizziness, but it can help lower the chance of a sudden blood pressure drop catching you off guard. If you live with diabetes, there is one more thing to keep in mind. Not every shaky or dizzy feeling is from blood pressure. Low blood sugar can also cause weakness, sweating, confusion, or trembling. If your care team has told you to check your blood sugar when you feel symptoms like that, follow their plan. And if you have heart failure or kidney disease and have been told to limit fluids, do not suddenly start drinking large amounts of water in the morning without asking your clinician what is safe for you. Small habits should still fit your personal health needs. I also want to talk about the warning signs that should never be ignored. If standing up is followed by chest pain, trouble breathing, fainting, one-sided weakness, a drooping face, slurred speech, a pounding or racing heartbeat that will not settle, severe confusion, or a new severe headache, get medical help right away. If you actually pass out, that should be checked. And if the dizziness is happening often, even without those emergency signs, please bring it up with a healthcare professional soon. You do not need to wait until you fall to take it seriously. Sometimes people tell me, "I don't want to make a big deal out of it." I understand that. Most older adults are trying to stay independent, not complain, and get on with the day. But protecting your independence is exactly why this matters. The goal is not to scare you. The goal is to help you stay steady, clear-minded, and confident in your own home. Small changes can protect big things. Your balance. Your freedom. Your peace of mind. So tomorrow morning, I want you to remember this. The first 30 seconds of your day are not a race. Slow is smart. Pause. Move your feet. Sit first. Stand second. Pay attention to what your body tells you. And if dizziness when standing has become part of your routine, let that be a reason to ask questions, not something you silently accept. You are not weak for needing a slower start. You are wise for giving your body the support it needs. If this helped you, share it with a parent, a spouse, a friend, or a caregiver who may need this reminder. And before you go, tell me in the comments if you've ever felt dizzy when getting out of bed, or if you're going to try the pause, pump, and rise routine tomorrow morning. I'm Dr. Amelia Watson, and I want you to take that next step safely.